Welcome back to Focus on South Texas. Substance abuse can really take a toll on the user and their families, but there is a way to address this issue, and it's statewide. We're talking about Be Well Texas. They provide low barrier, high quality care across the state to help those with mental illness and substance use disorders. Here to tell us more, Dr. Jennifer Sharpe Potter, Vice President of Research and Professor of Psychiatry and Behavioral Sciences at UT Health San Antonio. Dr. Potter, welcome to the show. Thank you for being here.
Thank you so much. Delighted to be here.
So let's start with this. 'Tis the season. The holidays are here, and that can be a really tough time for people who are struggling with substance abuse issues, or perhaps they suspect a loved one may be. What do you say to people during this time? How hard can it be?
Well, the first thing I'll start with, it is the season to be jolly.
Of course.
Unfortunately, that's not always the case. Holidays can be stressful, and it may be a time in that person's life where things aren't going as they'd hoped. And as a result of that, we often find that people may not be feeling as jolly as some of us are. And so it's a time when people are at risk for mood disorders like depression, or their symptoms may be exacerbated. Anxiety can often be up unexpectedly. And it can be stressful to be in the holidays, and sometimes people choose to use alcohol or drugs a little bit more than they normally do, or it may exacerbate a problem with substances.
So if someone watching right now maybe thinks that sounds like me or that sounds like my spouse, what are some key symptoms?
So first off, it's good to know that you are not alone. Substance use and problem substance use, like problematic drinking or using drugs, is quite common in the United States. And I say that because there's so much stigma. So the first thing I would say is, if you are concerned that you or a loved one have a problem, talk to somebody. Go to your healthcare provider, your doctor. You might look at getting a screening at a clinic. That's one of the things you mentioned, Be Well Texas, that we can do. Check it out. Get a checkup, just like you would for any other health condition, and see if there's a problem. A couple signs to look for: if people in your life are spending time expressing concerns about your drinking or your drug use, if you are aware that you're spending more and more time using drugs or alcohol, and that is interfering with other things, it becomes more important to use alcohol or drugs than it is to play with your kids or to be with friends and family. If you're isolating, that's also another warning sign. All of these things are signs and symptoms of there may be an issue with substance use.
So we referenced Be Well Texas. We should also mention that you're the founding director of the Be Well Institute. It's new, relatively new. It's at UT Health San Antonio. How did this come to be? What's the goal here?
Well, it's so exciting because Be Well Texas started to bring high quality evidence-based services throughout Texas. So everything we do is science-based, means that we believe it's proven to work. So everything that we offer. The Institute is really the result of a lot of success we've had in bringing these programs throughout Texas. And so UT Health San Antonio, my beloved institution, recognized all of the accomplishments that our scientists and public health practitioners were doing, and see this as an opportunity to really make a difference. San Antonio deserves the very best.
Sure.
And when people are challenged, we want them to be able to have the very best treatments and services available to them. And the Institute is a way to develop new treatments through research and also deliver those treatments to our community right here in Bexar County.
Well, without counting on my fingers, you started in March, we're here in November, so relatively new. How's it going?
It's going well so far. We had a good, strong backbone. Our university is very supportive, and we're continuing to grow.
Okay, so Be Well Texas, if someone like we mentioned is watching and they suspect they may be at risk or are struggling, how does Be Well Texas help out?
We help in a lot of different ways. The two examples I'll give are our treatment programs. We have virtual, meaning we have in-person and virtual services, so somebody can participate in clinical care from the diagnosis of a substance use disorder or the recognition of an alcohol issue, and then have all of their care delivered remotely. We can also have people, if they choose to come in person, they can come right up to our clinic. We're a very welcoming place. We offer, and we like to think that we start with compassion. Our slogan is welcome. We're very glad you're here. No judgment, no stigma. Come on in, and they can find us a couple different ways. We have a website, Be Well Texas. It's very simple,
Sure.
bewelltexas.org.
Easy to remember.
Yes, and then we also have a phone number, 888-85-BE-WELL. The other thing that you'll find when you call us or you reach out is we offer programs that are relatively new in Texas. They've been around, but it's a little bit new, called peer recovery support services. Sometimes a healthcare provider, a doctor or a counselor, is very useful, but they're not the whole story. There are groups of people called peers who are trained and in long-term recovery. They've walked the walk. They understand the journey of recovery, and they're here every day along the way to provide those services. And those services are at no cost, just like our treatment. If you don't have insurance or if you are having difficulty paying, there are eligibility assessments that we can do, and we can provide the care at no cost. And that includes all the medical services. It includes the medications as well as the labs that you might need. It's just like other healthcare, and you should be able to take advantage of it.
I asked this to our previous guest, but I think it's instructive here as well. Are there any success stories that come to mind where someone says to you, hey, this made a huge difference in my life?
It's such an important question. I mentioned stigma earlier. There's a lot of judgment, both unfortunately sometimes from the healthcare community, but also from people around you when you talk about drugs or alcohol and that you might have a problem. And sometimes even in yourself, there's shame that comes with this. The funny thing is the reason I chose to work in substance use is because it was a place in mental health that I saw people get better. I saw the stories of recovery, and we have those every day. I was recently at an event where we received an award as a community service leader, and it was so striking how many people came up that talked about the fact that 10 years they'd struggled and now they're in recovery because they received high quality evidence-based care. We have stories like that all the time where people are able to talk about this, and it's because they did the hard work, but they're also at a place where we're offering the very best care possible, and everybody should have access to that.
And this is exciting. I understand the Be Well Institute recently received or was awarded 2 grants.
We did. Thanks to Bexar County and the county commissioners, we competed for 2 projects. The first one is really reaching out. Sometimes we make it very hard for people to come to the doctor, and we like it to be that maybe the doctor should come to you. And the doctor should be out, perhaps even on the street, with partners that know how to work with people experiencing homelessness, who might not have access to transportation, who might really be struggling. And if you look around San Antonio right now, particularly in certain neighborhoods, you see people that aren't necessarily as fortunate in circumstances where they may not have a house to stay in, but they still can get access to health care, and that is a way to help them. And substance use is very common in that population, and so this grant is essentially, it's a street medicine program where we're working in partnership with a great community organization called Corazon to go out with their outreach professionals and bring the doctor and the health care to them, with the hopes that through that they're able to start to reclaim different parts of their lives and perhaps then use our services in person or virtually, but not on the street. But it's a goal to get people and raise their lives. The other program I'm very excited about is with a group called Unity Recovery. It will be the first recovery community organization in San Antonio and Bexar County. And you remember I was talking about peers and how important, sometimes a peer is far more important than I am, because that's a person who's been through the same journey. This is an entirely peer-led community organization, a community center, if you will, for people to come and talk with someone, to get services, to get connected to treatment, and also just to talk about the journey of recovery and get support, because it can sometimes be a little lonely.
Are we making progress on fighting that stigma?
Yes. I think conversations like we're having today are part of what begins to break down stigma. I often say I love people who use drugs. And what I mean by that is that this is around us in our community all over the place, and your listenership and your viewership knows people in their lives. This is very common. When we start to talk about this, just like you and I might have a conversation about cancer or Alzheimer's, we're starting to break down a perception that it's not safe to talk about drugs. We have to talk about drugs and alcohol because it is impacting our children, our loved ones, and our community in ways that has a lot of impact.
Before we go, one more time, the website. BeWellTexas.org, just like it sounds, and then 888-888-85-BeWell. 888-85-BeWell, that's the hotline.
Yes.
And then the website is BeWellTexas.org.
Thank you.
Dr. Jennifer Sharpe Potter, thank you so much for your time.
Thank you.
Hope we help some people out there. Really important work you're doing.
Thank you so much.
Thank you.